Operation Recon is a non-for-profit organization which advocates for survivors and their loved ones battling with traumatic brain injury from the war in Afghanistan and Iraq. Operation Recon was established in 2011 at Fayetteville State University. Operation Recon stands for Resilience Equals Community Outreach Needs. It is our goal to rehabilitate and provide resources that will enhance their transition back into civilian life. According to the Department of Defense, from 2000 to 2012, 266,810 service members have suffered from TBI due to military active duty war situations. The height of military injuries occurred in 2011, resulting in 32,609 victims. Here we see the casualties of TBI from service members employed by the Army, Navy, Air Force, and Marines. Traumatic brain injury, simply referred to as TBI, is a disruption in the brain functioning one may experience as a result of a blow to the head. During this disruption, the brain may shake inside of the skull. It is the goal of Operation Recon to promote awareness and understanding to the military families of Fort Bragg and their surrounding areas. The most common results of TBI come from military blasts, motor vehicle accidents, assaults, and a direct strike to the head.
Brain injury can cause physical, cognitive, vocational, and social changes. In many cases, recovery becomes a lifelong process of adjustment and accommodation for you and your loved ones. The goal of rehabilitation is to help you and your loved ones live and function as independently as possible. Family members and caregivers are the most important members of the rehabilitation process at Operation Recon. Everyone is affected by the injury. That's why everyone should be included as much as possible in the recovery process.
A person with TBI has problems understanding and communicating with others. Some basic language problems are difficulties finding the right words to tell others what they want to say, talking around a topic, never really getting to the point, difficulties keeping up with a conversation, especially if talking to more than one person, difficulty starting a conversation, talking about a topic that is too personal, offensive to others.
TBI comes in different forms of severity. As such, symptoms and treatments differ as well. Therefore, to fully understand TBI, we must first take a look at their differences. The three types of TBI are mild, moderate, and severe. The terms mild, moderate, and severe are used to describe the effect of the injury on the brain functions. With complicated mild TBI, CT scans and MRIs allow doctors to see any bruising or blood clots that may be on the brain. Also, the consequences may have long-term results. Uncomplicated mild TBI, however, are without blood clots or bruising. When a person suffers from mild TBI, they lose consciousness for 30 minutes or less. The person has the ability to open their eyes, speak, and follow commands. A person suffering from moderate TBI may not have the ability to open their eyes, speak, nor follow commands. Also, they may be unconscious for longer than 30 minutes as well. More often than not, their unconscious state must last for days or weeks, and in the worst case scenario, indefinitely. Memory loss before and after the trauma is highly likely. With severe TBI traumas, the symptoms may become permanent.
Some individuals with traumatic brain injuries, which is TBI, have problems functioning throughout their everyday life. Here at Operation Recon provides support to families, members battling with TBI. Nearly 400,000 soldiers and civilians have been diagnosed within the last decade, and those who are wounded may have not been properly treated. The problem occurs when damage is done to the brain. A person with TBI may experience difficulties such as making quick decisions, unable to pick between two or more choices, handling difficult problems or issues.
Some of the symptoms associated with moderate to severe TBI include but are not limited to anger, blurred vision, change in taste and smell, depression, dizziness or fatigue, headaches, inappropriate behavior, irritability and lack of awareness, language impairment, organizational difficulties, poor coordination, problem-solving difficulties, sensitivity to light and noise, and slowed processing speed.
People with a brain injury often have cognitive and communication problems that significantly impair their ability to live independently. These problems vary depending on how widespread brain damage is and the location of the injury. Problems may include the following: trouble concentrating, slow processing or taking in information, problems with recent memory, and trouble starting tasks and setting goals to complete them.
Operation Recon provides support to family members battling with TBI. TBI is a common injury amongst soldiers in war zones. The rate of nearly 400,000 have been diagnosed with in the last decade, and those who are wounded may have not been properly treated.
Although all brain injuries must be assessed in a hospital setting to ensure an accurate diagnosis, Operation Recon wants all family members to know there is treatment. Each family can provide their own unique assistance to your loved ones while enhancing their quality of life as well.
Caring for an injured family member can be very demanding and result in economic loss and emotional burdens. It can change the nature of the family and affect the cohesiveness of the family unit. If you are caring for a partner, spouse, child, relative, or close friend with TBI, it is important to recognize how stressful this situation can be and to seek support services. Here at Operation Recon, we have recommendations to help you care for your loved one and once they have returned home. You will want to provide structure and normalcy to daily life. Establish and maintain a daily routine. This makes your loved one feel more secure in their environment. Be prepared to repeat what you say, orally or in writing. Some people with TBI may have short-term memory deficits. Wait for your loved one to accept the offer of assistance. Do not over-assist or be patronizing. Be patient, flexible, and supportive at all times. Make sure your loved one understands you and avoid interrupting the person. Treat your loved one with dignity and respect and courtesy. Try not to overwhelm your loved one with false optimism by saying things such as, "You will be all right," or "You will be back to work in no time." And always treat your loved one as an adult by not talking down to them. In addition to Operation Recon, other resources in the community include Fayetteville Brain Injury Support Group. This group meets the second Tuesday of the month from 6:30 p.m. to 8 p.m. The meeting place is at Cape Fear Valley Rehab Center, formerly known as the Southeastern Regional Rehab Center, in the patient dining room, located at 1638 Owen Drive in Fayetteville, North Carolina. For more information, contact Ellen at 910-486-1101 or ellen@ncmail.net. Next is the Fort Bragg Brain Injury Support Group for military only. This group meets the third Wednesday of every month from 9 a.m. to 10 a.m. Their meeting place is at the Womack at Weeder Auditorium. Contact Elizabeth at 910-907-7898 or elizabeth@us.army.mil. And a few websites is a peer support website featuring discussion boards and a place to share brain injury stories, art, and more. Their website is www.tbihome.org. Next is caregiver.com, where you can sign up for a free Fearless Caregiver weekly newsletter, which guides you for best caregiver support. And next is a site that provides assistance on practical matters and gives meaning to the spiritual and personal challenges that result from being a caregiver. The site includes journal exercises, which are created to help you express writing about the issues that you are challenged with in your role as a caregiver. The website is www.caregivers.com.
We at Operation Recon are here for you.